Very warm good afternoon to everyone. On behalf of IAP India Digital Team, I, Dr. Jaspreet, welcome you all in the webinar on Pulse Electromagnetic Frequency, PEMF treatments and Oska pulses, a game changer of modern physiotherapy treatments, including severe acute respiratory distress syndrome. Now, I would like to welcome our today's guest, Dr. Sanjeev Kumar Jha sir, IAP President, Dr. Ari Rani sir, Chairman International Affairs IAP, Dr. K.M. Annamalai sir, General Secretary IAP, Dr. Ruchi Vashne ma'am, Treasurer IAP, Dr. Mashrat sir, Dr. Nehal Shah ma'am, and our today's speaker is Mr. Michael Hawker sir, and our today's moderator is Dr. Bruce sir. I welcome you on this our platform on IAP India. We are streaming live on IAP India YouTube page. I request to everyone to please subscribe IAP India YouTube channel for getting regular notifications. You can also follow us on Facebook, Instagram, LinkedIn. And now I request to Dr. Sanjeev Jha sir have few words to grace this occasion. Thank you.
Thank you, Dr. Jaspreet, and let me welcome from the side of IAP to both the great person, Mr. Michael and Mr. Bruce. And I feel PEMF is one of the modality what we should use more. I know that this particular modality is being used in metro cities more of, but it is not there in more of in say about B grade cities and C grade cities of India. And as far as pain modalities are concerned, pain modulation is concerned, and using in various acute respiratory syndromes, definitely I will be looking after of this deliberation from the side of Mr. Michael, that how it helps out to our patient. But let me tell you a big thank to uh, Nikesh Saab and Chittupal Saab, and both who have connected through IAP, and IAP is really looking forward to take physiotherapy to a grassroots level in India. So it is still villages level. We have a plan to do that. And as Dr. Ali was saying that he is already using this modality since last 10 years. So he is also a person who can contribute a lot on this particular modality. And I feel that this type of modality which talks about more of drugless therapy, talks about more of no any side effects, talks about more of treating a patient more faster than the other modalities should be promoted as far as possible, and more often it should be taken up by many of the young physios who are really going to contribute a lot through this modality to our patient and to our society. So yes, all the best from my side, from the president desk to Mr. Michael and Mr. Bruce. And I feel that this is a start of the journey. We all together will reach to a different milestone and definitely change the arena, the way we are treating by physiotherapy and by these modalities to our society and to our nation. So naturally, this particular modality is a lot of needed in our society. So I feel this particular webinar will be very fruitful to our professionals, and especially our ECs there, Dr. Anna Malai, Dr. Masrat and Dr. Nehal Shah. And let me tell you, sir, that we are having now more than 450 branches all across India, and we are having now more than 300 around women cell branches across India. So it is, we are only IAP office bearers are around more than 6,000 office bearers of IAP. So we are having a large network in India, and definitely looking forward for your collaboration in future also, and looking forward to do something which will be fruitful to our patient and to our society. Thank you. Thanks a lot. All the best from my side.
Thank you, Dr. Jha.
Thank you, Dr. Jha. Thank you for those kind words. Michael and I are connecting with you all today. Welcome to you all. We're connecting from Perth, Western Australia on what has been a beautiful early spring day. I'm Bruce Filing. I'm head of marketing and PR for Oska International Operations. Firstly, to the I'd like to thank the IAP on behalf of Oska for creating this opportunity for us to present pulse electromagnetic frequency treatments and Oska Pulse, a game changer in modern physiotherapy treatments. Oska Wellness is a global player in the non-drug, non-invasive pain management devices sector, based out of San Diego, California. Nearly 15 years of research on PEMF by the R&D team led to the conception of a range of products within the Oska portfolio. Pulsed electromagnetic field therapy is a new age technology which uses low EMF frequencies in order to treat pain at a cellular level, instead of just masking the symptoms. Oska Pulse utilizes a patented E-Tech pulse technology that optimizes PEMF to a specific sequential treatment protocol that contains 4 programs recognized for their efficacy. The frequencies emitted by Oska devices mimic the same set of frequencies in a sequence emitted naturally by the body. Oska India is the first enabler of this breakthrough, non-invasive, wearable and portable PEMF technology in India. Thank you all, and over to you, Michael.
Thank you very much, Bruce. I just have to rearrange ourselves here. Are you going to move? Oh, you are.
I request to, Dr. Annamalai sir to have some few words with us.
Sure.
Please
Just
unmute yourself.
Dr. Annamalai, please unmute. Yeah.
Yeah. So it's a great pleasure to be a part of this wonderful program. I would like to congratulate Michael Hacker and Bruce just left. And thanks for giving this kind of new technology with the specification of COVID. It is a very critical time. So most of the people are turn up with the ARDS, adult respiratory distress syndrome with a stiff lung. So I think the topic which has been pulled me to understand that it is going to help in ARDS. So in that sense, I think this will be a catchy phenomena right now, the time, because it's a time tested. I don't know whether it is a time tested, but it is time bounded now. So you are going to give us great about the cellular physiology and all these things to our entire members. And definitely it is going to helpful for our society, and really appreciate that your presence. And we are expecting that your expertise should be used for all the patients around the country through our therapist in the future also, with some kind of collaboration with our association. And really, I don't want to take much time. Best wishes. We can start. Yeah.
Now I request to Ali sir, please have some few words with us.
Is it me or
Yes, Ali sir.
Ruchi?
Yeah. Yes,
Yeah.
sir.
Good afternoon, everybody. Welcome, Michael and Bruce, to talk to us in India. Thank you, Dr. Jha, Dr. Annamalai, Dr. Ruchi, and all the CEC members who are present. We welcome you with your new innovation to India. Michael, just a few questions to tell you, as I had spoken earlier. We have been using this machine, but it's a combination one. You are different. What you are going to talk about, what I know is PEMF, but I have used the combination one, which has combination of microcurrent and infrared. That is FIR, far infrared. So I didn't know, whatever my studies have been, it's on a combination of 3 different voltages going in the body. And maybe what you all will be talking may be more useful. And definitely, just to tell you, we are more than 50,000 physiotherapists in this country, and maximum papers are presented in the subject of physiotherapy. So I'm sure with your unit coming to India, it will boom lot of, I almost have 50 postgraduate students every year. But if the machine has reached India, I would love my students to do a study on it and show you the results, which
Thank you, Dr. Ali.
you want.
Thank you.
All the best. I would think the next hour, but my phone list.
Thank you. Now I would like to thank an entire CEC and participants who have joined us. Now I request to Michael sir, please take over this session. Thank you.
Thank you very much. First of all, thank you, Dr. Jha. Thank you, Bruce, for that introduction. And thank you to the IAP committee and its members for allowing me this time to talk to you. I realize that many of you are very busy, and in this pandemic that's surrounding everyone around the world, this is of a great concern to us all, and thank you for your time. I hope that my input can be of value to you. I have a PowerPoint presentation. I ran through it earlier on this afternoon, and I've got to be careful that I don't waffle on too long and spend too much time telling you stuff that you already know. So what I'm going to do is I'm going to share my screen straight away in order to keep me on track. And if I don't do that, then chances are it'll take a lot more than 45 minutes. I'm just sharing my screen. So hopefully you are able to see my screen. Can you, somebody put a thumb up to let me know you can see what's on the screen at the moment? Great, thank you very much. I'm going to be talking about pulsed electromagnetic field therapy, and I'm going to call that PEMF. It's easier to say. It's been a game changer in modern physiotherapy treatments, and so I'm really thrilled to be behind this. My background, as you can see on the screen now, has been in the electronics industry for a long, long time. In fact, I think I was about 17 when I first started, but the last 18 years I've spent in the bioelectronics, the science of PEMF, and developing the Oska pulse. I have to say, though, that I had a great deal of assistance from my granddaughter, Jade Riggins, who has a Bachelor of Science degree in both biological and biomedical science, and also a friend of mine who is an electronics engineer, Ian Rumble. Without these two people, it would have been very difficult for me to have achieved what I have with the Oska pulse. It was many years ago, back in the 17th, what is it? Oh no, I must tell you about this first. Luigi Galvani. It was really my science teacher many, many years ago. I think I was about 12 or 13 when my science teacher connected a battery across a frog's leg and made it twitch. And he said he was trying to copy the Luigi Galvani when he discovered that putting two different metals across a frog's leg made it twitch. And that was my interest in biomedical science many, many years ago, but my interest in the electronics industry really took over from that. So I want to quote here from University of Melbourne: electrochemistry is how we move, think, and remember. And increasingly, as technology miniaturizes and computer power multiplies, it's how we're treating a chronic illness. And that's a quote I thought was very appropriate to us today. Pulsed electromagnetic field therapy was introduced back in the 19th century by Nikola Tesla. And as I mentioned earlier on, there has been some suppression of that in the United States and other areas, but right throughout Europe, it's been recognized as an important modality. And it's only just been recently, since NASA became involved and stimulated more interest in it, when it proved that PEMF improved the speed of bone healing. Electromagnetic fields are generated by currents of electricity flowing through a wire. And that really means that just about everywhere we go, we're surrounded by magnetic fields. That's homes, factories, offices, hospitals, anywhere connected to an electricity supply, we will be subject to electromagnetic fields. And of course, we use those in power tools, hair dryers, and the alternating, the alternator in your charges your car battery. They're just a few examples of how electromagnetic fields can be used with no harmful effects. And PEMF is different to, it's pulsed electromagnetic field therapy is different to the randomly generated magnetic fields that we come across every day. PEMF, particularly with the Oska pulse, has carefully constructed waveforms and frequencies and a controlled delivery method. And we do that by controlling not only the flow of electricity, but the pulsing that flows at a certain frequency and creating specific wave shapes, forms, duration, and hence that term pulsed electromagnetic fields. And on the left, you've got a few examples of various waveforms. On the right, there's a screen example of some of the bio waveforms that you may have already seen on some of the medical equipment, probably in your own possession. So 15 to 20 years ago, you will have seen pictures of these before, I'm sure, where it was virtually using very large, expensive machines, such as the ones that you can see here. The guy at the top left-hand side has got two hoops, one around his chest and one around his legs. The guy at the bottom there has four big coils around the body, and machinery in those days had to be fairly large. And then, of course, we have the controllers that control the amount of flow that's going through those coils. The last 20 years, technology has allowed us to miniaturize electronics needed to produce those electromagnetic fields. So not only that, we've learned a great deal more about the function of electricity in the human and the animal body. And that's allowed us to create the Oska pulse. So what exactly you're asking is, what is the Oska pulse actually doing, and how does it work? And first, we really have to look at the construction of the body, and scientists estimate that anywhere between 30 and 100 trillion cells make up the human body. There's still some question about how many, and I guess that depends on the size of the human body we're talking about. 200 different types, yes. Well, they're finding new cells that they didn't know existed. Just about every day of the week they find more cells. But the fact is that all cells need energy to function. Cellular energy requires ATP, that's adenosine triphosphate, and it's fundamental to all the cells in our body. And ATP, as it says on the bottom of the screen here, ATP regulates cell metabolism by transporting chemical energy within the cells, and low energy or low ATP levels cause the cells to lose their ability to regenerate or properly function. And that's the desire of the Oska pulse, is to speed the regeneration process. It's not a pain blocker. It never was designed to block pain. It's designed to speed cellular regeneration. The cell's membrane, as most of you know, it has two basic functions. First, it's the ability to transmit signals from one part of the body to the other through the central or the peripheral nervous system. And the body's nervous system conducts that electrical charge mainly using chemical, the exchange of potassium and sodium ions passing through neurons that provides that information to and from the brain. And secondly, it allows the cell to function a bit like a battery. It provides power to operate the organelles embedded in each cell. You know, I think this is one of the best images I've seen of the interior of a cell, showing the structure of the organelles with the plasma membrane, the organelles that are inclusive of Golgi apparatus, mitochondria, ribosomes, and of course the nucleus that holds the DNA that specifies what kind of a cell that is and what it's going to turn out to be when it regenerates. Similarly, in muscle and connective tissue, chemical activity produces the energy in the form of that ATP required by the cells to perform that job of regeneration before replacing as they die. Yeah, I've got an image here. I said that it works a bit like a battery, and a torch battery chemical allows the flow of electrons from one element to another. That's the chemical inside the battery. and it creates the flow of electricity when the positive element of one is connected to the negative element of another. So that's the flow of electricity. And neurons, they behave virtually the same way. It's a chemical action through the synaptic cleft that is shown here on the left-hand side. You've got the synaptic vesicle that passes passes the chemical. There's the exchange of sodium potassium at this point that creates that electrical differential across the cell membrane. I don't know whether any of you have seen this, but this is an image, or it's a video clip that appeared on the internet a few months ago, and I love it because it actually shows the way in which neurons transfer information. And I'm going to stop it right at the end because there's an important bit that I want to show you. Oh. That's where I want to stop it. I hope you got the sound effects there. That really gets to me every time. But you can see there the synaptic cleft and the transfer of the chemical action across from the neurotransmission of that. It's called a synapse or a synapse. It depends on where you come from. And I think it's important to recognize that that is happening in your body. Not at that speed, of course. It's about 250 miles an hour. I think that's about 400 kilometers per hour. And that's happened a million times as we move and speak and think. So the human body, as you know, is an electrochemical machine, and more often, more so now that we understand that than ever before. And it's the electrochemical charge, although it's very small, it's only around about 70 millivolts or 70 thousandths of a volt. It doesn't really need to be very large because it's occurring in that very, very small nerve cell space. So what happens when you're sick or injured? When we're sick or injured, in the case of injury, surgery, or degenerative issues such as osteoarthritis, these endogenous or natural electrical potentials are impaired. It's the lack of exercise, electrolyte imbalance, long-term use of medication, dehydration. These are just a few that impair those electrical potentials that are normally generated across the cell membrane. I want to talk about the need for physical exercise, which everyone on this conference will recognize. It's vitally important to cell regeneration and therefore recovery after injury, surgery, or in order to combat degenerative conditions such as osteoarthritis. I learned about this many, many years ago, the compression and recompression of the proteoglycan cellular matrix during exercise that creates that chemical action. I'm going to tell you how it's called strain generated potentials. And I'll explain how I found that out because it was quite a light bulb moment in my life. I actually fell off a roof about 20 years ago, and I broke all the ribs on my left-hand side and damaged my wrist. I broke all the small bones in my wrist. And screen share's off. Screen share's off? Is it off?
It wasn't screen sharing yet.
Oh, apparently my screen share had stopped. So I'll come back to that in a minute. So I fell off a roof about 20 years ago. I smashed all the small bones in my wrist, and my wrist was pinned, and I couldn't move it. And my surgeon told me that it was important to exercise. And I said, well, isn't that going to break what you did there? And he said, no, it's very important that you exercise, because it's exercise that speeds the regeneration process. And I said, well, how does that do it? And he said, it's the compression and recompression of the proteoglycan cellular matrix that causes an electrical charge across the cells, which stimulates its regeneration. And if I didn't exercise, I was a candidate for osteoarthritis in later years. So I did the right thing. And when the pins came out, I exercised. It was at that moment that when he said about the proteoglycan cellular matrix and the compression and decompression, he actually gave me a white paper on it, which I can actually supply to you if you would like it. I'm just going to go back and see whether I can share my screen again. Hopefully the screen is there. And so I'm just going to read out what I have on the screen here, because this is a portion of and the most important part of that paper that he gave me to read. And remember, this was 20 years ago. Exercise results in the movement of positively charged ions in the fluid matrix past the fixed negatively charged sulfate proteoglycans. Thus, when the bone and the other tissues are mechanically deformed, they become electrically charged. And when we walk, and this, I think this is the important bit, when we walk, run, or move, the weight of our body causes the cartilage to compress. And this compression deforms the entire matrix and forces the high negative charges in the proteoglycan to move close together. At the same time, those charges across the collagen fibers are deformed, which increases the total negative charge around the fibers. And this is what attracts the sodium, potassium ions towards that area. And then there's the recompression as that force is released. So I don't need to go into that, but it just enforces the fact that physical exercise is really important. Now, had I had the opportunity of putting that Oska, which I didn't have and wasn't invented in those days, across my wrist, it would have sped the recovery process. Instead of me having to wait 4 or 5 weeks for those pins to be removed before I could exercise, that would have been invaluable to me at that particular time. So Oska has been designed to mimic the endogenous electrical energy by producing a modulated PEMF signal that contains 4 stimuli important to the natural phases of tissue repair and pain reduction. So we actually need to speed the recovery, but without the possible trauma associated with physical exercise or physical loading. And it's actually ideal for speeding and assisting the recovery from sporting injuries, accidents, wounds, surgery, or for combating degenerative conditions such as osteoarthritis. For a number of years, my granddaughter and I worked on not only the frequencies. Some people get hung up on frequencies, but we looked at waveforms, pulse widths, the intensity and the duration. And we worked on that for, I think it was around about 6 years, to create a treatment protocol into a sequence that follows as close as possible the body's own natural healing process. So in the Oska Pulse itself, there are 4 distinct protocols that run for 30 minutes. There's the angiogenic, the chondrogenic and osseous, and a minor pain relief signal, not a pain blocker, but a pain relief. And I'll tell you how we do that in a second. So the 30-minute sequence is repeated back to back as many times depending on the device version. There are three versions, the 90-minute, the 3-hour and the 6-hour one, which I'll explain later. That's all organized to speed the healing or cellular regeneration. And it works like this. During each 30-minute session, Oska Pulse rotates through the 4 precise frequencies targeted at key cell types designed to accelerate the resolution of tissue inflammation, response, improve microcirculation, and to degrade the pain signals and stimulate tissue repair. And it does that through those 4 cycles. Let's have a look first at the angiogenic phase. We need to, it's really important to get more oxygen and nutrients to the area that's being treated. And active cells require oxygen, nutrients that give off waste, including carbon dioxide. So the first phase is really devoted to inducing capillary arcade. Now, if you come from, if you're trained in America, you'll call it capillary. In England, it's capillary. So I'm going to call it capillary because it's easier to pronounce. So the first thing that we need to do is to increase blood flow and oxygen to the area. And of course, the appropriate thing there is to get rid of waste products as well. So we're actually exchanging blood through the lymph system, which filters out the toxins and pathogens from the body. So that vascular phase is really important in setting the right scenario, the right balance to go on with the next part of the treatment phase. So the next one is the chondrogenic phase. And you'll recognize the image on the right-hand side here, which shows the matrix, the proteoglycan cellular matrix. The emphasis on promoting fibroblast and collagen fibers. Fibroblast, as you know, is a type of cell that produces the extracellular matrix and the collagen, and it produces a structural framework for all animal tissue. And it's a major cause of joint pain with the loss of collagen. So the next one is the osseous or bone phase. And really it works in conjunction with the previous chondrogenic phase, because they all belong to a family of connective tissue cells. So it improves bone density. We have I lost count of the number of our users of Oska who have come back to us and told us that they've had tests and they're amazed at the increase in bone density, which is really important for people that are suffering from osteoporosis. So now I've got 2 images on the screen here, and these I came across many years ago, but it helps to emphasize what happens when we can speed the recovery process. It shows the natural realignment of fibroblast cells over a period of time. Now, I have no idea in these 2 images what period of time that was, but I've simply got it there to show that the implications are that when using Oska for treatment post-surgery or sporting injuries or workplace accidents, it speeds the process from the left to the right and improving structural alignment that would normally take weeks, and the Oska Pulse would do that in days. We've had surgeons that have said to us, orthopedic surgeons have reported they cannot believe how quickly their patients have recovered and now walking on their ankles after surgery, knees, hips. They're amazed at the speed in which people are recovering. The final phase of Oska Pulse is pain relief. Now, when we developed the Oska and we were in touch with the hospitals in San Diego, they said they did not want a product that blocked pain like a TENS machine. They said pain was there for a reason. It's to tell you that you have a problem. So whilst long pain relief is effective through recovery, there is a need to deal with the affected pain as soon as possible. So what we've done is we've introduced a pain reduction signal to assist in that pain relief. So in this phase, it actually puts the brakes on the pain signal. It's not strong. It depends on your level of pain and what your interpretation of pain, because everybody has a different idea of what their pain level is. So some people notice it straight away. Others say, no, it's made no difference. But the objective is to just provide a satisfaction level of pain reduction. And this is how we do it. And I'm going to read this off because otherwise it'll take me too long. And if we look at the voltage across the synaptic membrane under no pain conditions, the level is around about minus 70 millivolts. That varies. I'm just going to use minus 70 as this, in this example. On the approach of a pain signal, the membrane potential increases to somewhere around about a positive 30 millivolts. And that's allowing a sodium flow. This in turn triggers the synaptic vesicle to release the chemical transmitter and so transfer the pain signal across the synaptic cleft. And you've seen an example of that. So what the Oska pulse does, the final treatment protocol applies a specially crafted PEMF or electromagnetic field to the painful site, and it causes the membrane to be lowered to a hyperpolarized level. So when a pain signal is detected, the voltage must now be raised to a relatively higher level in order to fire the synaptic vesicles. But that change is now almost too great, and it limits the voltage to the synaptic vesicles that slow the release of the chemical transmission. So what we've done is we've slowed that chemical transmission and hence reduced the signals that are going to the brain, but it's not completely blocked, because our philosophy is we want to put the fire out rather than just turn off the alarm. I've got a paper here that shows the range of clinical disorders that respond to PEMF. And now this is not just Oska Pulse, but there's a huge range here that I'm sure everyone's come across, and those involved in PEMF would have used PEMF for the treatment of these conditions. The ones that stick out straight away, as far as I am concerned, and what we have found with the Oska, is fibromyalgia, tendinitis, plantar fasciitis, carpal tunnel syndrome, bursitis, osteoarthritis, and stress fractures. They're the ones that stand out for us. We've had a great deal of success with that. Rest, ice, compression, and elevation. I guess that's something that as a physical therapist, you have been used for many, many years, and it's a recognized modality. Oska Pulse and workplace sports injuries is a real marriage. It's another example or our example is the increased widespread use of PEMF technology for pain management and injury recovery. It's best known, I guess, in sports medicine circles, and is the power behind our own Oska Pulse, which is now a portable wearable device that targets those four key issues, types of pain relief and the source and speed of the natural recovery at a cellular level. So PEMF is widely used technology with successful clinical uses across a huge range, a huge spectrum of tissue regeneration and applications from bone growth through to pain management. I want to touch on ARDS, the acute respiratory distress syndrome, which really has come to the forefront in our situation at the moment worldwide. We recognize that inflammation is necessary and it's a beneficial process, but it's often, if it persists too long, then it can result in chronic inflammation. And chronic inflammation is frequently a cause of chronic pain, and worse still when it falls into the category of ARDS. Now, obviously, this condition is being exacerbated by the current COVID-19 pandemic, and previously sepsis was the most common cause of ARDS. Now, I understand that currently there's no cure for ARDS. However, apart from removing the source of the problem, the goal is to support that patient by getting enough oxygen to the area, to the lungs, to minimize the risk of more infection while the lungs heal. We've got a strong belief that the use of PEMF technology used in Oska Pulse may assist in not only boosting the immune system, but could assist in a much quicker patient recovery. Oska is pretty unique in the PEMF in this particular therapy protocol. The Oska pulse vascular phase helps the oxygen extracted out of the air we breathe to be transported in circulation through the body's individual cells. And within those cells, the enzymes and other basic cell energy production processes use the oxygen for cell metabolism, producing the energy, that's ATP, necessary to properly function. And after the oxygen exchange takes place, then veins carry the deoxygenated blood and metabolic waste away from those same cells and back to the heart for recycling again. So due to the increased evidence or incidence of lung inflammation, we've actually developed an Oska 360 device, which concentrates on the vascular phase. That actually runs for 60, the vascular phase in this device runs for 66.66% of its 6-hour treatment time. So you can see here that the emphasis in this 4-cycle treatment protocol is on that first phase. I think you can see my pointer there on the stage 1, the capillary, capillaries, I should say. That's the most important phase in this treatment protocol. And just over 66% of his time is spent in this area. So when it comes to concentrating on inflammation and the need to provide more oxygen to the area under treatment, that first phase of Oska pulse sequential treatment protocol is considered to be the most important. The vascular or angiogenesis phase is the physiological process promoting capillary arcade. That was the word I was trying to think of a few seconds ago, capillary arcade. Apart from stimulating the lymph system, this facilitates the provision of more oxygen and nutrients to that area being treated. And in particular, it benefits those suffering from ARDS. The lymph system is the body's cellular sewer, and working in conjunction with the circulatory system, it drains toxins via the lymph nodes, and these toxins are generally the result of phagocytosis and the way the body attacks and destroys pathogens. And the lymph system is an integral part of our immune system. And with that in mind, that's why we produced the Oska 360 intense device, and it runs for 6 hours. It's 360 minutes. And evidence, both clinical and anecdotal, suggests it is greatly assisting where there is a need to focus on that chronic inflammatory process. I'm drawing close to the end. I think I have about 5 or 6 to go. Acute respiratory distress syndrome and the Oska 360. PEMF, as used in the Oska pulse, enhances, this is a summary, it enhances the immune system while optimizing blood flow for the provision of more oxygen and nutrition to the damaged cells. In positively charged cells also increase ATP, and that's what we need. The cells need more energy to fight infection. And PEMFs ultimately decrease the chance of infection by initiating healthier tissue. So that's the summary of the Oska 360. And I think that's been, that's a duplicate. So a serious word on power. You know, many practitioners they believe that power is the most important factor in this technology field, and yes, it depends on the machine, the reason for it being used. We've taken advice from many clinical trials pointing to the fact that the body's electrochemical system runs at a very low voltage, around about 70 millivolts, at 70 thousandths of a volt. And the resting state of the cell membrane is sitting around that 70 millivolts, and the body's natural sodium pump modulates cell membrane to allow the exchange of important ions, such as sodium, potassium, and calcium. And the most important factors for successful PEMF treatment is actually what we found is the crafting of those waveforms, the shape, the intensity, and the frequency to suit the specific purpose of using this technology. So whilst we recognize that depending on what the device is being used for, there is a purpose for power. As we have constructed the Oska Pulse, we don't need the power that is necessary in other devices. We're looking at a very, very small current in a concentrated area of around the size of a beach ball. And that's what we've done. And the other thing is to combine a series of treatment protocols, one after the other, which as far as we can work out is the way in which the body's natural healing process takes place, but has been compromised by injury, by degenerative issues, or by surgery. Several people have complained that after using the Oska Pulse, and this may be with other PEMF devices as well, that shortly after using the device, their experience of pain has come back. Painful experiences can trigger danger messages to the brain. So using a new device like the Oska may send a kind of a wake-up call, but it's really a false alarm. It's a bit like poking a stick at an ant's nest or rattling a canary cage. It's actually stirring up the brain's memory of a painful event. It has been suggested by a number of doctors that certain glia cells may be responsible for this retention of pain memory. And I think there are about 6 or 7 different types of glia cell, but one in particular is responsible for maintaining memory of injury. But once the brain accepts the fact that there is no need to be alarmed, Oska Pulse will be allowed to get on with its job without setting off the pain alarm again. And that's been our experience. It shows that the Oska is actually working, it's doing something. And as long as they can push through that very short space of time, then the process will take place naturally. I just want to thank you for your interest. I really do appreciate the fact your time is very valuable, and you've given that time to me this afternoon to share that information about our product, which I am very excited about. So I'm sure that you are going to have some questions, and I'll stop sharing my screen, and it's over to you. Thank you very much.
Thank you so much, sir, for such informative webinar. Now I request to Masrat sir, please have some few words with us.
Mr. Walker, it was a beautiful presentation, and we are very pleased that you are here. You have given us a full insight into PEMF. First of all, I'll congratulate our Executive President, Dr. Sanjeev Kumar Jha sir. And Mr. Walker, you'll be pleased to know that in spite of the COVID pandemic that we had one of the best World Physiotherapy Day celebrations, wherein a vast network of physiotherapists participated and showcased their knowledge and their talent, not only among each other, but they reached to the far-flung areas and gave their services to all the needy, the COVID needy. Our theme was COVID. And in keeping with line with the same continuation of the educational extravaganza that we had, we are here to uplift and update ourselves that you have done wonderfully, sir. Regarding the PEMF, regarding the PEMF, you talk about the ion exchange and the cellular level and the ATP production and all that stuff. Sir, as you will be glad to know that in India, the latest thing for us was laser, but when you use laser, it approaches or it goes only to a particular area. But since you're using the concept of ATP and other things, so we can think that this PEMF not only helps in bone healing, but it is there for the holistic growth and holistic benefit of the whole body as a whole. You would be glad to know, sir, as the largest representative body of the physiotherapists in India, we have the platform wherein we can take your word and give it to the general masses, because we have a vast network of physiotherapists with different branches all over India, and we'll be glad to share that and share this unique thing that you have, so that it reaches the masses, and we will act as a bridge for you, so that you can reach the physiotherapist community of the whole country, which is one of the largest in the world, and we will give you the access to all of them, and we hope to have a very, very good relationship and partnership with you. Thank you so much, sir.
Thank you very much, Dr. Mazarat. We are very grateful for what is happening with your team over there in India.
Thank you so much, sir.
I
Very
request to
encouraged.
Nilesh ma'am, please have some few words with us.
Am I audible?
Yes, ma'am.
Yeah. So yeah, thank you very much on behalf of IAP. Thank you very much for this session. Let me tell you one thing, that we at our place, we have been using pulse electromagnetic frequency since, I guess, 2012. If you are aware, we are using magnetodyne, and we've been using it for a lot of fracture healing. So we have our studies of non-united fractures. We have used this magnetodyne, and our paper is on the way. Very soon we will be publishing the data, and we will be but yes, this is a very good modality. We have been working on it a lot, and thank you very much for giving all of us an insight into it. I thank IAP India to have done this kind of a webinar. Thank you so much.
Thank you very much. Thank you, Dr. Shah.
Now I request to Dr. Ali Rani sir to please conclude the session. Thank you.
Thank you, Michael. It was great hearing you and looking forward to use it as a study. And I'm sure our postgraduate students would love to use it on different type of patients, and hopefully give you the report how well it does for us. Definitely in respiratory condition, in all the conditions we have spoken, we can ask a student to do a study. Wishing you all the best, and once again, welcome back. Welcome soon to India. Thank you.
Thank you very much, Dr. Ali. I really appreciate that. And one day I hope to be over there and enjoy the sights, the sounds, and meeting you all.
Welcome. Welcome.
Definitely, we'll be waiting for you.
Thank you everyone. Thank you every participants for joining us. Now I request again to everyone to please subscribe IAP India YouTube channel for getting regular notifications of all webinars. You can also follow us on Facebook, Instagram and LinkedIn. Thank you.
Thank you very much. And once again, thank you to Dr. Shah. Thank you to the IAP committee and all of its members for allowing me to share this time with you. Thank you.
Thank you, sir.